Hello, social problems. This week we watched a video on Texas's multi-million-dollar health facilities, which is one of the main hubs for medical tourism, which is one of the things that we're talking about this week in class. So in the video, it talks about what medical tourism is and why people go to Texas for it. So that's what we're going to be talking about in this video. So what is medical tourism? According to the video that Dr. Van Quest says, is he says it is when a patient will travel to another destination outside of their hometown to receive medical treatment for reasons like needing a faster treatment, wanting to pay less money for better doctors if they feel like the ones in their hometown are not good enough. So that is kind of what medical tourism is, or if they want to get a specific treatment like in a certain way that maybe isn't legal in their state, or perceive that procedure is not done in their state. So that's kind of what Van Quest explains medical tourism is. He also explains the word tourism is used in the terminology because people don't only go to these places for the medical aspect of it. People also will kind of turn going to these places for a medical situation and then turning it into sometimes a trip, and they also use like tourist like attraction type things because they're obviously you are a tourist if you're not going there, if it's not your hometown and you're going to restaurants and you're going to fun shops, you are a tourist. So that's also why the word tourist is brought into the word medical tourism, because tourism is kind of used as like, oh, you're going on a vacation, you're there for fun, but it can also be used in a medical standpoint. He also talks about why Houston's medical center is the biggest facility in medical care in the world, and it is because of all of the treatments that they provide. They provide cosmetology, heart procedures, like body procedures and repairments, and so many. They have such a broad treatments like for people to get done that's one of the main reasons that people go there, is because they have well-trained doctors who are versatile, and you can get so many things done in one place, especially if you're really struggling with like bigger health issues and you need different kinds of procedures. It's a good place to go because they also have really good housing there. Since Houston is such a big place and their facility is so big, there's so many different places that you can stay for when you're getting your treatments done. So like if you need to get an apartment for a while, if you need to be going in and out of hotels, Houston has good places that are connected with the medical center that's one of the reasons that people stay there, is because they can stay there for such long periods of times and not have to spend too much money, and they're taken care of outside of just being in the hospital room. And you can also get out of the hospital bed and stay in one of the like housing places near the center instead of just at the in the hospital beds, which is what other places can be like. They also talk about how as kind of times have gone on since 2020, people have gotten sicker, as Van Quest says it. The world has become a sicker place, as he says. And as people get more money, they want to live a healthier lifestyle. And since 2022, in recent ages, people have been able to make more money, especially with, rising increase of costs of things. Payments have also increased, minimum wage has increased. So when people get more money, what do they want to do? They want to make themselves healthier. They want to make themselves look healthier. They want to be healthier. They want to live a healthier lifestyle, especially in this day and age. Living healthy is kind of the thing. And so people want to go to these places to get, live a healthier lifestyle, get procedures done to make them healthier, look healthier, and feel healthier. So that's also why Houston has become such a big place, because it's a way for people to live a healthier lifestyle with so many versatile things that you can do in one place. So outside of Houston, a medical tourism destination that I looked into was India. India is it's a very big place that people go to when they're looking for medical tourism. Some of the most common procedures that I researched that people get done there are cardiology, orthopedic surgeries like knee and hip replacements, cosmetic surgeries, dental care, oncology, which is cancer treatments, and ophthalmology. These are a lot of treatments that people will go to India to get done. And the treatments are known for being 60 to 90% lower cost. And that's one of the reasons that people go there, is because if they want it done and they can't afford USA's medical care costs, they can go to India, get a vacation out of it or whatever, and get their treatment and, get their vacation and staying in a place for care for, you can get this whole trip out of what you could maybe get at your, like at a hospital that's maybe a few hours away in the States. So that's the main reason that draws people into India, is also they have good aftercare for their treatments as well, knowing that people are coming to their country for care who don't usually live here. They have good aftercare places that people can stay, for recovery. So it's a big place that people go to get things done quicker, to get a vacation, and to get more money for what you're getting. You can get a trip and you can get whatever medical care you need. The financial impacts that I found from this was India's medical tourism market is estimated to be worth $6 billion. According to the United States Market News, they said it's $6 billion, which is actually quite a bit for, for countries like lower, not as big countries receiving people who are coming for medical care. That's pretty big. So that can really help India in paying stuff for their country. If they're bringing in so many people for medical care, that can help their country a lot, with paying for stuff that they need outside of just medical care. That's really good for their country. Mortality rates that I found with traveling to India have actually lowered in India in the past few years, with only 30% of medical tourism patients experiencing any infections from procedures and 0.5 expecting any complications. And there were only 50 deaths within 10 years in India for their medical treatments, which is actually pretty impressive, because if you compare that to the States, I mean, I know we're a lot bigger, but we probably make way more, mistakes, even if you were to take the chunk of states that would equal to India, we might make more mistakes. So they're known for they don't have high mortality rates, which is also why people might want to come to India and drag them into India. So that's what I found on a different country when it comes to medical tourism. And for my own personal experience when it comes to medical tourism, I have personally never had to go anywhere for any treatments, but I do know I have many family members who have had to go to Sioux Falls for treatments like surgeries, like bigger surgeries, like brain surgeries, heart surgeries that Aberdeen does not provide, and we have to go to Sioux Falls for those. Or even Minnesota. I've had a teammate who's had to go to Minnesota to look at some stuff in her lungs, in her chest, in her ribs. I feel like as you get older, you kind of hear a lot more people, as they get older and they experience more heart problems, hip replacements, stuff like that. People will travel outside of my hometown of Aberdeen and go to Sioux Falls and go to Minnesota, Rapid City for their surgeries. So that's kind of there is a lot of medical tourism in Aberdeen since we are such a small town. So I do see a lot of medical tourism personally. So that's kind of my personal experience. But yeah, that's my take on medical tourism.